I'm Shahar Azani, and welcome to this episode of Eye on Israel. A few months ago, I read an op-ed whose headline attracted my attention: A Jewish Heart in an Age of Anti-Semitism. From hate days to verbal abuse and physical attacks, it seems that the last few years have seen a significant increase in anti-Semitic incidents across the United States and indeed the world. These incidents coincided with anti-Israel sentiment amplified, sadly, by social media. One of the most frustrating facts is that contrary to these hateful movements, many Jews around the world, as well as in the state of Israel and the state itself, are responsible for so many people out there who are living today a better life. From groundbreaking inventions which revolutionized the world to Israel being there time and again in times of emergencies, there is so much to be proud of as Jews and lovers of Israel. Indeed, the hatred does not deter us. As the op-ed I had read clearly states, despite the ongoing verbal anti-Semitism and violent displays of hatred, it is our responsibility as the Jewish people to embody the concept of tikkun olam, to repair the world. It's our duty, despite the hatred and intolerance around us, to strive for a world that is more just, peaceful, tolerant, and unified. We must do good and incorporate the intention to do good in everything we do, including our business endeavors. Our special guest today on Eye on Israel is the author of this op-ed, Mr. Seth Bogner. Seth is the chairman and CEO of HeartPoint Global. He has more than 3 decades of experience in principal investing, structured finance, and merchant banking across numerous industries. Seth is a visionary entrepreneur who has served as the CEO and president of many entities. He has closed over 200 investments and overseen countless merger and acquisition transactions during his career. In his current role, Seth merges his exceptional leadership abilities with his long-time goal of creating a business that is both profitable and socially responsible. He and his team deliver breakthrough medical solutions for cutting-edge cardiac care that are affordable, safe, and minimally invasive. Seth, thank you so much for joining us today at JBS.
Thank you, Shahar. Thanks for having me.
I want to start with asking you about your career path that's led you to where you are today. How did it come about?
Well, I get bored, so I tend to start in one industry and then do something that's a first or a breakthrough, and then move on. My background is structured finance, and it's my background as an investor that brought me to HeartPoint. 10 years ago, a couple of brilliant doctors from Zurich took me first to Kyiv and showed me blue babies. And then they showed me a way that instead of having open heart surgery, where 90% of the kids in the world don't have access to cardiac care. And then they showed me their idea for something that, on a minimally invasive basis, can help these kids get over their, we now serve over 10 indications, so it's not just these poor blue babies with Eisenmeinger's or near Eisenmeinger's. And it has succeeded beyond my wildest expectations to do all the things you spoke about.
You spoke about.
Yeah, but you said much more eloquently than I did.
But the idea from transitioning from somebody who's so, submerged in the world of finance, which we're so familiar with in New York, investing, mergers, acquisitions, and here you are, not just an entrepreneur, but one who is doing it from the heart.
Well, you get to a point in your career, you want to do something and leave some type of legacy. And when you see how many problems there are in the world, how things need to get better. We're getting shots from above. We have wars. We have lack of leadership. We talked about anti-Semitism. These are big shots across the bow. So we, as people that have had some luck, have been fortunate. We live in spite of all this, we live in the greatest time in the history of the world.
It's that attitude that I want to focus on for a minute, because when I read your piece, I must tell you, a lot of people get angry with anti-Semitism. A lot of people ignore it. They choose to look the other way. Try to, thinking that if they only stray from it, then it won't be there. And here you are in your piece. Not only are you standing up, calling out anti-Semitism, but you're overcoming it by saying it won't deter me from doing the right thing. Where do you get such resilience?
Well, because it's true. You just have to take a step back and stop trying to scare people. It's the same thing with the earth and its resources. I think that with the technology we've been gifted today, there'll be enough food and natural resources for the entire world.
Right.
I think we have to do it in a responsible way, but that really sort of called to me where I felt that we have to. And it's not just me. There are a lot of people that feel the same way like I do. We have to make capitalism evolve to the next level. And it's not reinventing capitalism, because of course we want to make money. We're not communists. Right. But if you make money and your intention is to do something special, something for, not just for the sake of making money, but something for humankind at the same time, it's very, very doable. I don't like these businesses that say we're going to do this and we'll give lots of money away. I don't think that's a genuine, feeling. I think our intention, even just our name HeartPoint, it comes from Hebrew. Yes, I wanted
to ask you about that.
Right.
Name.
It comes from Hebrew, Nikadot Bashalev. So you start with the point in the heart, and then everything comes out of that. So
that's where it caught you. When did it become a legacy project for you, Seth?
Well, I saw the great scientists and doctors that had put so much effort into it, and I just had made an investment, and about 5 years into the investment, I saw it wasn't going as I would like it to run as a business. So I did the same thing I would do for any other company, and have done for many other companies, which was rolled my sleeves up, hired the right consultants, and say, what are we missing here? Why isn't this moving the way we would like it to move? And about that time, I started putting my own people in place and took over the running of the business, not on a full-time basis at that point. That happened about 2 years ago. I started really spending the majority of my time on this because the business demands that type of focus. Right. And it's not,
it sounds less of a business to me. I mean, not that it's not a business, but listening to you, it sounds so much more like a passion, Seth.
Well, we talked for a second about, 90% of the kids in the world. Okay, so every year there are 140 million kids born into the world. 2% of them are born with congenital heart issues. 10% of those kids, it's a little under 2%, but 10% of those kids are potentially patients of ours. And that's not just in the developing world, that's in the developed world too. A lot of these kids get better, especially kids that have holes in their hearts, ASDs, VSDs. Those heal in a lot of cases by the time the kid's 4 or 5. But, millions of kids, especially in that 90%, never have an opportunity to even target their problems. Right. And as they get older, these problems like becoming blue babies evolve, or they develop things like, left heart issues. So here we have a patented, revolutionary device.
Wait, so the problem, let me just understand.
Sure.
The problem you're trying to cope with at HeartPoint Global is that of not just congenital heart diseases of kids, but what are the issues you're coping?
Well, we're very fortunate that our device serves over 10 different indications.
10 different
And not all of them are cardiac, but most of them are. We have decided to focus first on pulmonary hypertension in kids for a couple of reasons. even though we do solve the big issue, heart failure is the biggest killer in the world, and we serve the largest subsection of the largest subsection of cardiovascular disease. But I think that very few people are focusing on pediatric hypertension because people don't generally spend money on things that work for kids. Right. It's not as profitable. We know that we will be serving left heart as well, but also the path for approval with the FDA and with the EU, we get a lot more attention, and we will get breakthrough designation by focusing on kids. So while it serves the world, it also serves us because we're getting to market. We'll get to market faster by focusing on kids. So this is a perfect example of how
business and passion intertwine.
Of how doing good, you can be good by doing good.
Right. And even do well while doing good.
And serve our shareholders at the same time.
And when you're talking about these issues, there is also a matter of access, right? Costs. The HeartPoint Global provides for more access for these treatments than these patients might have otherwise.
Yeah, listen, if you're talking about left heart issues and somebody needs an LVAD in the United States, that's $1 million over 10 years. Now, we're not necessarily a replacement for all LVAD patients. Right. That's an artificial heart, a left ventricular assist device. But we're either bridge to heart transplant or other things. Our cost is $4,000, so it's disruptive.
$4,000.
Yes, $4,000, which is a cost that we also developed in conjunction with what reimbursement would be in the developing world. Now, that's disruptive by order of magnitude.
Right.
When you look at the $1 million that an LVAD would cost, and you look at our device, now, there really is no effective treatment for kids that have pulmonary hypertension due to congenital issues. The medication that's out there is very expensive, doesn't work as well as the manufacturers would like us to think. And so here, we know because there's a surgical example that we built ourselves around that goes back to when Eisenhower was president, and it's something called pulmonary artery banding. So what we do is, and that's a very tough open heart procedure where they crack open ribs and they tie a wire around the pulmonary artery. Being in the pulmonary artery itself is very exciting. And what we can do by being there is work on a lot of different indications.
And this is, your device requires what? No surgery? No?
No, we've developed with interventional cardiologists, and it goes in through the femoral and travels up the body and up into the pulmonary artery and its branches. So we are, this is very, going into the pulmonary artery was something that people didn't think was doable a few years ago. And we've proved them wrong. And it's for kids and for adults.
In a way that's done in a non-invasive manner.
Exactly.
Non-invasive.
Safe. And even patients that couldn't qualify for surgery because they weren't strong enough, if you were late stage patients, things like that. So we're focusing that on pulmonary hypertension, structural pulmonary hypertension, and I think it's a great place to start, but that's only where we're starting. We're going to go to a lot of places.
Right, nekuda shebalev. We start with that point in the heart.
Exactly, and that point in the heart expands to the world, and that's the whole message of if we do good, we act good, we be good. It sets an example for the world.
Yes.
And that's what we're supposed to be doing.
Yes.
We as, I'm Israeli and I'm American, and I love both countries very, very much.
But it seems like you're doing something out of love of humanity.
But isn't that what we're supposed to be doing?
Yeah,
as
that's what
Jews?
we're supposed. But listen, even the notion you're shattering here as we sit here on this glass table, and you're shattering the idea that business is only a matter of the mind. For all that I hear from you, and so much that I hear from you, is the infusion of that business mind of yours with the incredible heart and passion that you put into HeartPoint Global.
Yeah, but look at somebody like Steve Jobs. He put that same type of passion in something that improved and really changed the world.
Right.
We're not Apple,
right.
But I think on a small scale, he was doing the same type of work we're doing. He had a vision. He saw how it was going to be. There were ups and downs. There were some bumps in the road.
I want to touch on the bumps for a minute. As an entrepreneur, seasoned investor, you're trying to do something that's right, and yet the world presents you with all sorts of challenges, obstacles, hindrances. Maybe share a little bit of that journey, the kind of phenomena that we've seen in the world in the last few years. How has the world impacted what you're trying to solve?
Well, obviously we're an American company. We started in Switzerland. When we took over the company, we started moving it to Ireland and Israel because those were the medical tech hubs. And we were hit very hard, like everybody else, with COVID.
How did that affect you?
Well, for us, it wasn't that bad. What it did was we worked all over the globe, so we didn't have to get used to Zoom calls.
Right.
That's how we operated.
Right.
And the team was in Israel, the team was in Ireland, the team was in America, the team was in Switzerland. So everyone was used to working together like that. It was hard. What it did force us to do was to develop 2 supply chains, because then we had the supply chain issues,
right.
And we still are fighting those issues. But we did things that go against my nature. My grandfather always told me the 11th commandment was not to build inventory. But we built inventory of certain parts that we need, and we've now are dealing with all of what's come out of that. And I guess the worst situation, one that we really could not have predicted, was what happened a year ago.
Right.
We had spent years working in Kiev. Our sponsor.
Right, you mentioned Kiev.
Yes. Yeah. Well, I started there 10 years ago, but we're preparing to do our first in human and all of our clinical trials there, because we have 2 business models: one for the developed world and one for the developing world. Ukraine was the perfect country to create something for the developing world, because Kiev is a first-class city. It's a world-class city. The rest of the country is like the developing world. And so we had a agreement with the hospital run by the former 2-time Minister of Health and the largest private hospital chain in Ukraine to create a reimbursability model. So not only we literally had tickets in our hand when the invasion started.
Wow.
And then everyone was saying, "Oh, it's only going to be 10 days. Don't worry about it." It really had caused us to take a big step back and work with a lot of other countries, because we're now, you first have to focus on humanitarian cases.
Correct.
Make sure everything is safe,
right.
And then you go into a smaller study, and then you go into a 400-patient study. Ukraine was especially situated because they had agreements with the EU that the data we collected in the EU, in Ukraine rather, would be accepted in the EU. So it's
you don't work in a void.
No, you don't work in a void, and it's not getting knocked down. It's not getting up. And so each one of these things we look at as a challenge. These are not the biggest challenges that we faced, right. But it created time. All these things created time challenge, and time is money. Right. And we're doing this without partnership, and we still haven't found the right partner to work with us, whether it was a fund or a organization. But the partnerships we have created have been amazing for us. For example, we're partners with something called the Eurasia Heart Foundation, which has helped us to first of all, the chairman of our medical advisory board, Paul Vogt, is also the chairman of the Eurasia Heart Foundation. And that's one of the things that inspired us, because they go into developing worlds and they teach doctors, and this is what we could do, is make the footprint much broader, because you don't need to be an interventional cardiologist to use our system.
I'm sorry. I have to. Business, passion. Now I'm hearing you talking about diplomacy, war and peace, expansions, working in the developing world. It's incredible just to listen to you. You know, one of the things that attracted my attention, you mentioned Israel as a hub, one of the hubs that you're working in, especially with your background. What are you doing in Israel, and what makes it so suitable for what you do?
Well, we kept getting pulled to Israel. First of all, I maintain a home in Israel. I'm an Israeli citizen. I spend a lot of time there. My oldest son lives there. You know, Israel runs through my DNA,
right.
and I love it. I love the energy. So we started by doing.
You're also the embodiment of the notion of Startup Nation.
Yes, you know, I wish we had gotten more help from the ministry, because we really haven't been able to get into that whole thing with the Innovation Authority, but it didn't matter, because things happened faster in Israel.
Right.
Things were more efficient in Israel. We did all of our preclinical studies in Israel. So our chief medical officer is also David Planner, who's head of interventional cardiology at Hadassah University Hospital, is in Israel. You know, it's just so much of the good stuff, especially when you're developing new technologies.
Right.
I think Israel needs to get better at encouraging companies to stay once they develop the technology.
Right. That's true.
But I love working in Israel.
You find the right ecosystem for the leap.
Absolutely, and for a lot more, you know, and for great friendships, and for.
But at the end of the day,
esprit de corps.
Right,
you know.
but it's also your business acumen. The idea that it makes sense business-wise, and how wonderful that on so many other levels it also makes sense. Like, you wouldn't compromise the quality and the the viability of the business just because you love it. You're able to combine both.
No, you have, of course, because of Technion and other places, this unbelievable quality of professionals. Yeah, we're a little hard around the edges. Yeah, we're a little aggressive.
Right. Right, but that helps move forward at the end of the day.
I also think that bringing our philosophy into the ecosystem that's there, the Startup Nation ecosystem, there's been a little too much of let's move forward and figure out the exit and go to the next one.
Correct.
We're all for the exit. We're all for making money for everyone, but but it's like, if you focus on the exit, you'll get to that exit. But if you focus on helping people and making money for your shareholders, you'll do both. Our model is based upon creating cash flow in the developing world and building up approvals in the developed
So I
world.
want to ask you, just because we're running short on time, I'm listening to.
I can't believe we're running short on time.
I can't believe it either. I'm hearing a great, groundbreaking invention that can change lives across the globe.
Yep.
How can that? What's the trajectory? What's going to happen? What's the distribution channels? When is it going to happen? When can our viewers go if they're in need? And there are so many people who are in need out there, and make use of this incredible, groundbreaking invention.
Well, we deal in a highly regulated environment.
Correct.
And we dot our I's and we cross our T's. And I believe that it will be accessible in the developing world much quicker than it will be in the developed world. But because we chose to focus on something that helps kids and, congenital pulmonary hypertension, we will be doing, the next 2 years or so, doing groundbreaking trials in the United States and Europe. And
so you think it's going to be available sooner in the developing world?
Absolutely, because we're going in the developing world. We're not only going to be doing our trials, but we're going to be looking at reimbursability, looking at what the government needs are. The government wants their people to be healthy. And there are a lot of other things that we're working on. We're working on a SaaS application because follow-up in the developing world isn't great, but everyone has a cell phone. Right. And so there's an NFC application that we're working on.
And here in the U.S., you're expecting it to take a few more years?
Yeah, we think it's
and cost-wise, will you be able to maintain a reasonable...
No, we need partners. I'm very open about that.
Right.
We've spent a lot of our own funds, and we're very dedicated to moving the project forward. But we do need help, and people said, well, why don't you focus more on the charities? But we're a for-profit business,
right.
And we're focused on being for-profit. And I think that we're speaking to several parties now. I think we're going to get the help we need.
With the kind of tenacity that I'm hearing in between your words and sentences, there is very little that you, Seth, won't be able to achieve.
Yeah, I think that we're at a special time in the world where you either have to step up or you get consumed. You get consumed by the negative news. You get consumed by all these problems that are in the world, or you step up and you become part of that solution.
Just like when we spoke about anti-Semitism. Yeah. Nothing will hinder you on your mission, and what's been very evident is your long-term vision in what you're trying to achieve.
Yeah, I think a lot of anti-Semitism is focused on us because we're not doing that extra work that we're blessed with and that we're capable of doing. How does the state of Israel create these size economies?
But we also don't share it enough. And this is why I'm so happy that here now, what's the biggest anti-Semitic trope? Is Jews only care about themselves. And here we're sitting with Seth, who's telling us not just about Israel and Jewish, but talking about, a different kind of capitalism, of caring for the world, of tikkun olam. These are incredible notions that I wish not just our viewers, but if you can take this message onward for people to understand just how deep that's coming from within.
Well, it all starts with the unity of the Jewish people. Right. So if the Jewish people all focus a little more, I don't even say I think the system of the world that has been created doesn't require everybody to be in the same boat at the same time, moving in the same direction. But it works if people start thinking about these things, about working together, about unity, about doing something better for the world.
Correct.
The world will automatically become a better place.
Correct. That's also been a big part of who I try to be. So you set a great example, Seth. Thank you so much for sharing this incredible vision and for really sharing your heart with us and with our viewers.
Thank you, Shahar.
Thank you very much. Thank you, Seth, for your leadership, your sense of morality. It's a true inspiration to see someone who's not deterred by hatred and continues to lead our world in the right path. It sets an example both personally and in business. And what a great inspiration it is to understand that people like Seth Bogner and others are at work in this world, where all that we're used to seeing on the mainstream media is the hatred, the animosity, and the negative news. And we take the moment, as we took today, to really dive deep into the depth of the heart, be inspired and be encouraged to follow that kind of light. I want to thank you, Seth, for taking the time to share this incredible story with us and with our viewers. And I'd like to thank you all, our viewers, for watching. Can't wait to see you next time as we cast another fascinating eye on Israel. See you next time.